Very good afternoon, friends. Meeting again in the session of Materia Medica. One remedy from the second year syllabus, which was not covered and which is from this new syllabus, CBDC, that is the Calcarea Iodata. A small remedy, not so well proved, but very well utilized at clinical level. One of the remedy where one of the remedy from Calcarea group, which is again warm-blooded, hot patient. Generally, calcareas are chilly, but this Calcarea iodata is very specifically a hot remedy. It's from tubercular to syphilitic miasm, where iodum comes. Generally, all iodums always affect the glands. So glandular affections are very, very characteristics over there in Calcarea iodata. And it has very specific affections for two things. First, it has very specific affections to the thyroid gland. Second, adenoid. And third, in females, breasts. Basically, it is a very useful remedy for enlarged thyroid, goiter specifically, or it is one of the important remedy for the thyroid cysts, the cysts inside the thyroid. Thuja comes very close over there, as Murphy has said regarding it. And it's clear that whenever the thyroid cysts are there, first remedy is Calcarea iodide, second remedy is the Thuja. Then it has very specific affections for adenoids, specifically in children. This thyroid enlargement is generally at the age of puberty. I want to share one case. She was nearly about 22 years of age when she first time met me, who had a very typical goiter over there along with hyperthyroidism. And she had little bit protruding eyes. She was so weak. Her weight was 32 kg at that time. And she was absolutely hot, warm-blooded. And she was perspiring a lot. Tachycardia was marked. And it was pure case of hyperthyroidism. She has taken many treatments for that, but she was not recovered. And she was brought to me. She was quite fair-skinned girl, and her problem was very difficult to treat. But looking towards her, the first important thing, when I looked towards the sonography report, there were big thyroid cysts which were there. The enlargement of thyroid was because of the cystic development over there in the thyroid. Second, she was warm blooded. Third, hyperthyroidism. Fourth, she sweats a lot, specifically on head and during night. It was typical Calcarea feature which was there. And exophthalmos. Considering all those features, I have started her on Calcarea Iodata 30 in few doses for 3-4 days and followed with the Calcarea fluor as the thyroid swelling was quite hard. Within span of 1-2 months, she started gaining the weight. Her weight was increased and it was nearly about within span of 2 months, she had 37 or 38 kg of weight, and it was wonderful. She was responding very clearly to the Calcarea iodata. So she was followed treatment for nearly 1 year, and when she left the treatment and got married, she was 45 kg, and her whole swelling of the thyroid had disappeared, exothalamus gone, and she was looking quite normal, healthy girl. So Calcarea iodatum is a very important remedy for such types of complaints. It is also mentioned by Murphy. It is a good remedy for the cysts in the breast or tumors in the breast. That is another indication which is not explained in Boericke's Materia Medica, but this is one feature. And this remedy is having very specific action on the skin. In the scalp, there are two important words which are used. Crustallactia, that is the word which is used, and tinea favus. These are two words used by Boericke over there. Crustallactia is nothing but the cradle cap. there is thick layer on the scalp, and that is containing sometimes pus, sometimes fluid over there. It is a tinea infection, a ringworm infection. So tinea favus is on the scalp, capitis, it is like that. And it is on the ringworm of the scalp where the thick layer of the skin happens to be there, and these flakes comes out off and on. There is tremendous itching over there as the ringworm is there, and this has very marked action on it. So that is one condition for which it has been mentioned by Boericke. So let us open your Boericke's Remedia and go through the remedy. So Calcarea iodata, iodide of lime. It is in the treatment of scrofulous affections. Whenever the glandular affections are there, it is scrofulous affections, especially enlarged glands, tonsils, and that this remedy has gained marked beneficial results. Thyroid enlargements about time of puberty, flabby children subject to colds, secretions inclined to be profuse and yellow, adenoids. Yes, adenoid enlargement. This is one of the remedy one should not forget when patient is hot. Uterine fibroids and crow. Headache while riding against the cold wind. Lightheaded. Catarrh was at the root of the nose with sneezing. Very little sensation. Polypi of the nose and ears. So polypi of the nose and ears, whenever comes, Calcarea carb itself is a remedy. Calcarea iodata, then Sanguinaria canadensis, Sanguinaria nitrica, Kali iodatum, Lemna minor. There are many more remedies for the nasal polyps. Throat, enlarged tonsils are filled with the little crypts. So enlargement of tonsils along with the adenoid inflammation or enlarged adenoids, this remedy is very important. Respiratory, it is chronic cough, pain in chest, difficult breathing after syphilis or mercurialization. That means the syphilis treated with the mercury local application, and when it's suppressed, it affected the glands. Hectic fever, green purulent expectoration, crow, and pneumonia. So this also has action on the pneumonia or lungs over there producing pneumonia. Skin, very important affections. Indolent ulcers. Indolent ulcers means those are slow healing ulcers accompanying varicose veins. Varicose ulcers, varicose veins, and slowly healing ulcers. One must think about the Calcarea iodata. There is easy perspiration, copper colored and papulous eruptions. The tinea favus. Tinea favus means it is chronic fungal infection of the skull. Crusta lactea. This is pityriasis capitis, or it is also called as cradle cap. Swellings of the glands, skin is cracked, falling out of hair. That is one important feature. When patient comes with this cradle cap associated with the hair fall, one must think about the Calcarea iodata. Relationship, he has mentioned agraphis. It is bluebell, adenoids with enlarged tonsils. For that, he has compared agraphis. Here, sulfur iodatum follows both agraphis and Calcarea iodatum. Aconite, lycotonum, the swellings of gland, the Hodgkin's disease, this is the remedy. Compare also Calcarea fluor. Calcarea fluor comes whenever the glands are stony hard, and there are in goiter is also hard goiter, or there are nodules, nodular goiter is there. Calcarea fluor is one remedy. Silicia definitely comes over there as a comparison, having the scrofulous diathesis, but chilly. So silicia is quite chilly with sweaty palms. Merc iodatum comes very close to the Calcarea iodatum because both of them are hot patients and having the scrofulous diathesis. Dose second to third trituration, I have used the generally the 30th potency or 12C potency. So a wonderful remedy in hyperthyroidism, in case of exophthalmic goiter, thyroid cyst, then action on adenoids. Then it is also useful in breast tumors or cysts in the breast. This remedy has very specific action. So scrofulous diathesis, keep few things in your mind. Scrofulous diathesis, hot patient, hyperthyroidism, thyrotoxicosis, nodular goiter, cystic enlargement of the thyroid gland. These are common clinical features, and the enlargement of the adenoids. So these are very important clinicals of this remedy. So We have learned one more remedy from the second year syllabus. Be there with some other remedy when time permits. Thank you.